My name is Hanley Ward, and today my presentation is going to be on renal obstructive disease, but I'm going to focus mainly on hydronephrosis. At the end of my presentation, I will zoom in on the information so that you can see it better. Hydronephrosis is a condition where the kidney swells due to failure of normal drainage of urine from the kidney to the bladder. It most commonly affects one kidney, but it is possible for it to affect both. Hydronephrosis is considered a secondary disease rather than primary because it results from underlying diseases. After urine builds up for an extended period, your kidney can enlarge. When it becomes too large, it starts to press on nearby organs. If that's left untreated, your kidney can lose function permanently. The mild symptoms include frequent urination and an increase in the urge to urinate. Some more severe symptoms include abdominal pain, nausea, vomiting, pain with urination, incomplete voiding, and a possible fever. The most common complication with hydronephrosis is a urinary tract infection, UTI for short. To treat hydronephrosis, it depends on what's causing the obstruction. If it's a blocked ureter, you have three options. You can insert a ureteral stent, which allows the ureter to drain into the bladder, or you can insert a nephrostomy tube, which allows a blocked urine to drain through the back. And if necessary, or if it's not that bad, you can just use simple antibiotics to control the infection. If it's from scarred tissue or blood or a kidney stone, surgery may be the best option. The people who are most at risk for hydronephrosis are pregnant women because their womb enlarges and it presses on the ureters, men 50 years and older because of enlarging prostate, and sexually active women because of the risk for recurring UTIs. The sonographic appearance, in this top picture, which I'll zoom in later, the normal hyperechoic area in the center of the kidney is replaced by a large hydronephrotic renal pelvis. And when I zoom in later, you'll notice how the dilation extends into the parenchyma. In this second picture, it's a less severe case of hydronephrosis. The parenchyma has a relatively normal thickness, and the dilation extends from the pelvis to the calyces. It's considered a grade 3. And speaking of grading, in our book, Hagen Answer, Volume 1, in 1988, the Society for Fetal Urology proposed 4 grading classifications for hydronephrosis. The first one says small fluid-filled separation of the renal pelvis. Grade 2 is a dilatation of some, but not all, of the calyces. The calyx orientation will still be concave. For grade 3, the picture on the bottom, it's complete pelvocalyectasis. The calyx orientation changed in convex, and the echogenic line separating the collecting system from the renal parenchyma can be demonstrated. For grade 4, it's a prominent dilatation of the collecting system, thinning of the renal parenchyma, and no differentiation between the collecting system and renal parenchyma. The causes of hydronephrosis, it's not a disease due to the internal and external conditions that affect the kidney and the urinary collecting system. The most common cause is acute unilateral obstructive uropathy, which is a sudden development of an obstruction in one of the ureters. The most common is a kidney stone, but it's also common to see a blood clot or scar tissue. Acquired causes include bladder tumor, carcinoma of the cervix, a normal pregnancy, pelvic mass, or prostate enlargement. Intrinsic causes include bladder neck obstruction, inflammation, stricture, or calculus. And now I'll zoom in on the board in the next video.